Donald, good evening, Lawrence.
Good evening, Rachel. And maybe we now know why no one from the VA is a regular participant in those White House press briefings. Boy, do I wish there'd be a question in tomorrow's briefing about what you were reporting tonight.
I will tell you that our own beloved colleague, Stephanie Ruhle, has managed to score an interview with VA Secretary Wilkie tomorrow morning at 9 a.m. Eastern on MSNBC. And, of course, we've been, beating down the door trying to get him to do an interview with me, and everybody's been chasing him. He's been unwilling to talk until quite recently. And so I am very much looking forward to seeing Steph Ruhle go one-on-one with him tomorrow.
Yeah, we will both be watching at 9 a.m. tomorrow, that's for sure. Thank you, Rachel.
All right, thanks, Lawrence. Thanks.
Well, it's all about testing now. That's how the governor of New York, Andrew Cuomo, sees it. For him, coronavirus testing is his #1 issue, and that is why Mr. Cuomo went to Washington today to meet with the President of the United States. Here's what Governor Cuomo told Nicole Wallace on MSNBC immediately after his meeting with the President.
The meeting went well, and I think it was productive. The big issue was testing. As everybody knows, that's going to be the next step as we go forward. And how do we separate the responsibilities and the tasks on testing vis-a-vis a state and the federal government, and the acknowledgement that we all need to work together on this. It has to be a real partnership. And I think we had a very good conversation.
Governor Cuomo, maintaining diplomatic relations with Donald Trump, did not mention anything specific that the president actually agreed to. And the president didn't mention anything specific that they agreed to when the president appeared later at the White House press briefing. Governor Cuomo did say that he believes New York State has to double its current rate of testing from 20,000 tests a day to 40,000 tests a day. Dr. Zeke Emanuel will join us later in this hour to discuss a new action plan from the Rockefeller Foundation proposing what it calls, quote, an ambitious but achievable goal of rapidly expanding testing capacity to 30 million tests per week over the next 6 months. Dr. Emanuel is one of the contributors to that Rockefeller Foundation action plan. 30 million tests per week is over 4 million tests per day. A new Harvard University study says that we should be conducting at least half a million tests per day or more over the next 30 days. We are currently testing about 150,000 people a day nationally without any national coordination for the testing process at all. 50 states compete not just with each other, but virtually every other country in the world for testing kits and equipment necessary to do the testing. The testing crisis comes as the director of the Centers for Disease Control, Robert Redfield, gave an interview to the Washington Post in which he said a second wave of the coronavirus could be worse than what we are seeing now. He said, quote, there's a possibility that the assault of the virus on our nation next winter will actually be even more difficult than the one we just went through. And when I've said this to others, they kind of put their head back. They don't understand what I mean. We're going to have the flu epidemic and the coronavirus epidemic at the same time, he said. We'll ask Dr. Harvey Feinberg, an expert on infectious diseases, in just a moment, what he thinks about what that second wave could look like. Today, Donald Trump said, quote, we're going to do very significant testing. We're going to do very significant testing. And by we, Donald Trump does not mean Donald Trump or the Trump administration or the federal government. By we, Donald Trump means he intends to watch governors and mayors scramble to try to find ways to protect people and ways to test enough people so that governors and mayors can make careful decisions about when people can go back to work or go back to school safely. The county coroner in Albany, Georgia, told the New York Times that the coronavirus, quote, hit like a bomb. That leaves the mayor of Albany, Georgia, who will join us later in this hour, scrambling tonight to protect his community now that the Republican governor of Georgia has decided to allow the opening of some small businesses in Georgia, non-essential businesses. So beginning on Friday, if you really want a massage or a haircut or a tattoo, the governor says those businesses can all open everywhere in the state. And after you get your tattoo, you can go to the bowling alley, which is also allowed to open on Friday. Dr. Deborah Birx was asked about this at the White House briefing today. And once again, Dr. Birx gave the kind of answer that a Republican Party lawyer would give, an answer designed to protect any Republican office holder with a bad idea. Dr. Birx actually said that it's perfectly okay to open those businesses as long as you can maintain social distancing inside those businesses. Social distancing for a massage, social distancing for a tattoo, social distancing 6 feet away for hair cutting. Dr. Birx actually pretended that all of those things are possible.
If there's a way that people can social distance and do those things, then they can do those things. I don't know how, but people are very creative.
That is a purely Trumpian answer. Dr. Birx is saying someone can cut your hair from 6 feet away. Congresswoman Val Demings of Florida, whose name appears on a lot of political commentators' lists as a possible vice presidential choice for Joe Biden, will join us later in the hour to discuss the new package of relief legislation Speaker Nancy Pelosi and Senate Democratic leader Chuck Schumer have agreed to support, along with Republican leaders of Congress. The new legislation finally contains some money for testing, $25 billion to support testing. When Mitch McConnell first tried to bring the Republican version of this bill to a vote in the Senate, it did not contain 1 penny for testing, not 1 penny. The $25 billion to support testing in this country is in the legislation only because Democrats forced it to be in the legislation. And when Donald Trump signs this bill, probably later this week, he will probably once again invite no Democrats to the signing and not acknowledge any Democratic input in the legislation and claim full credit for the testing provision in the legislation. In his Washington Post interview, the director of the CDC, Dr. Redfield, said this when asked about protests against stay-at-home orders. He said, quote, "It's not helpful." Donald Trump was asked about that today.
The director of the CDC said the protests against stay-at-home orders are not helpful. You've encouraged some of these protests. What are your thoughts on the CDC director saying that these protests are not a good idea?
People, look, it's not a question of helpful or not. People want to get back to work. And I've watched some of the protests, not in great detail, but I've seen that, and they're separated. There's a lot of space in between. I mean, they're watching, believe it or not. Social testing, they're doing social distancing, if you can believe it.
If you can believe it. If you can believe it is one of those Donald Trump signatures that he frequently attaches to his lies. When Donald Trump says, if you can believe it, you cannot believe it. The protesters are not doing social distancing. Everyone in that room knows that the protesters are not doing social distancing. They are not carefully 6 feet apart. The protests are protests against the very concept of social distancing. If there was a serious public health official in that White House briefing today with the president, that person would have raised her voice and said something to the effect of, I have seen the pictures of those protesters and they are not social distancing and they are all risking their own lives by doing what they're doing, and they are risking the lives of other people in their communities, their neighbors and their families who they might come in contact with after being in the thick of one of those reckless and dangerous demonstrations. But everyone in that room working on the Trump team knows that being a Trump team member requires keeping their own safe distance from a truth like that. Amy Petrelk is a surgical trauma nurse at Stony Brook University Hospital on Long Island. Here is some of a video diary she has been keeping for us.
All the ICUs are still full. They're full. The sickest people are still there. Some people are getting extubated, but the truth is that there are still people